you know how tall you are? And DeBart says, well, duh, and many of you may be going the same way as that. Here's another way to think about it, particularly relates to mental health as well. And these mindsets are ways in which people make sense of the world. It's their epistemology, if you will. And so a socialized person is going to have strong tendency to follow the leader. They're going to have a strong tendency to do what others are doing. They want to be members of a community. And as they are doing that, they're following along pretty well. They're going to be challenged to come up with their own system, their own statements of that system. But they could with the right kind of questions. So as one clergy person I worked with was struggling with this notion of feeling like he needed to be perfect, feeling like he needed to be an ideal minister and not getting anywhere, we began to test what does that mean to him. And a couple of old examples of kind of abusive pastors, came to mind. And he was able to put those aside and begin to talk more about what ministry meant for him. And moving into that place was a mature, rational decisions that he was able to see a little bit bigger world in his world. And that moves toward transformation, at least it gets started on that. Maybe a picture is another way to talk about this. We hear a lot of problems of the life of ministry as life in a fishbowl. There were a few ministers, I didn't see who raised your hand, but would you agree, you disagree? I think that's not an uncommon image. There's books about that. And so this emphasizes privacy and the need to have some private space. That's not bad. And that does kind of touch on a number of these things, creates a lot of issues in the parish, and you better be able to negotiate those. And that involves relationships and discussion of how you could talk about your needs, how you ask for your needs, how you deal with others in their impression of you not working or not being available, and then responding in a way that's not, sort of run and hide or get mad or blame the other for all the kind of problems. You're able to have a mindset that's having different views and being able to negotiate those different views. And that's a fishbowl, but it's a different feeling of a fishbowl, where there's maybe some time for that. Probably don't have time for a story. But then another image of the fishbowl is this old adult education model, where you can have a broader discussion of an issue. And I think this would always be valuable from a mental health point of view, if we could have people talk about mental illness in a public way, not in just a private way. The stuff Nancy has talked about of that group is a marvelous beginning point. And how we can have those happen in a lot of different churches with a lot of people beginning to share is good. But I don't think that even goes far enough. I think the other notion of a fishbowl is, in fact, an ecology of care and concern, where people grow and are called into that growing community. And this is the kind of place where it does get kind of exciting, because this is the place where we can begin to attend to all the different systems, those in credo, those in the clergy support, those in mental health, those in the family, those with the children, can begin to talk about their developmental needs and the growth opportunities, and I think that's a good positive thing. You may have heard this. I've certainly come across this in more than one occasion. In working with clergy, the particular problems, we need to help them open up or tighten up. And they may be too enclosed, too encapsulated, too tight. They have to be opened up. Or they need to be loose, tightened up, where they're taking money out of the offering plate, or they're acting out in other kinds of ways. And those are all problems we've seen. But I think the developed point of view is the third one that we would add. And attending to these focus formation and formulation of how they are that.